Welcome to the Skelton Report. I'm Mark Nathaniel Skelton. Today we're going to be talking about your role in health behavior and health outcomes. Be sure to like, share, and subscribe for this information and more like it. All right, so as you know, I'm a mental health provider and I'm a doctoral candidate in a clinical psychology program that is specifically focused on health psychology. And what that means is we're taking a look at how your emotions and thoughts and behavior contribute to your overall health. And I thought this is really empowering because I want you to really understand what significant role that your own behavior plays in your health outcomes. So here goes this article from the National Academy of Medicine. And if you scroll down here, I'll click on this chart right here. I've seen this in class. It's in some of the literature as well. And I want to just share it with you, and you can do with it as you may. So, what I want you to understand is that your health outcomes out top is a combination of your health factors and different policies and programs. All right, let's break that down a little bit further. So, when I say health factors and policies and programs, if you look to the right, you'll see that is a combination of your health behaviors, clinical care, social economic factors, and physical environment. So if I could say more about that, your physical environment, air and water quality, basically where you're living, housing, and transit, that contributes about 10%. Social economic factors, 40%, basically the roll of the dice. I mean, kind of like income of the family you're born into. But of course, it's America. You can get education and employment and family social support, and however that looks for you, contributes about 40%. Then you have clinical care, which contributes about 20%. And when I'm saying contributes to your outcomes, we're talking about how long you live and how good you live. So your clinical care contributes about 20%, and that is your access to care and quality of care. All right, so a lot of the literature on that too, especially for minorities, are saying there's difficulties and barriers getting to healthcare, but also sometimes there's provider bias. Are you getting the proper type of care and referrals to specialty treatment that you need? That's under this umbrella. But this is the one that I really want you to zero in. Health behaviors. This contributes 30% to your overall health outcomes, meaning how long you live and how good you live. And this is made up by tobacco use, something that you can control. Diet and exercising, that's something that you can control. Alcohol and drug use and sexual activity, all these are something that you can control. And so I just think that's liberating. And I want you to know that a significant minority, all right, of what you're doing, what you can control. You may not be able to control the aspects of some of these, but you can control this aspect, which contributes to your health factors, that contributes to overall population health, which is, again, how long you live and how good you live. All right, so I hope that's empowering. I'm bringing it back in. Just know that what you're doing does make a difference, and you can cut out a lot of some of the chronic conditions that we end up with as a society, as an individual, based on the behavior choices that you make. All right, so that's all I got. I hope that was a blessing to you as it was for me. Be sure to follow me at Mark N. Skelton for more information like this. And the more you know, the more you grow. And I'll catch you on the next go around. Peace.